Hello and welcome to Sunset TV. You're watching India Fights, back with me, Rajat Kane. In this edition of show, we'll take a look at the need to boost vaccine production and supplies worldwide as we continue to battle the COVID-19 situation. The situation is particularly monitored in the view of rising numbers in several countries, including India. Well, this week at the meeting of Quad partners, the first meeting of the inaugural meeting, India, US, Japan and Australia, 4 countries that formulates Quad, pledged a landmark partnership to further accelerate the steps to be taken to address COVID-19 pandemic. Together, Quad leaders also shared action plan necessary to expand safe and effective COVID-19 vaccine manufacturing in the year 2021. So how important is it for major economies and major countries in the world to, of course, to come together and share same view in terms of manufacturing the vaccine? Well, to discuss this further, we are joined with Dr. Aparna Mukherjee. She is scientist from ICMR. Many thanks for joining us, Dr. Mukherjee. And Urvashi Prasad, she is public policy specialist from Niti Aayog. Many thanks, Urvashi, for joining us once again on the show. Well, Dr. Mukherjee, let me start at the outset with you, ma'am. In terms of the rising numbers, the trends that we have seen past 1 week in particular, what would you sum up about the COVID situation in the country?
Right. So, as you correctly said, that in the past 1 week, we have again seen a rising trend. So that only emphasizes that we should not be, complacent about our behavior and about the precautions that we are taking. It is true that the vaccines are available and the general numbers are less than what it was last year, but still we have to follow all the precautions that we have been requesting all through this pandemic. That is the social distancing, particularly the masking, hand hygiene, etc. So we really cannot be lax in this, complacent in this. And yes, normal life needs to go on, but then we have to take this responsibility as citizens to continue doing this.
Right. Ma'am, before I move to Urvashi here, I just one question I need to ask you. In terms of the rising numbers that we have seen of late, is it something usual that we see with pandemic concerned with the virus, or situation would be classified as something to be extremely concerned about?
It does come in waves. That is true. So, but since we were actually seeing a decreasing trend, which was very encouraging, and we are again seeing a spurt, as I said, that it is not alarming as yet, but then we need to be careful and not let our guards down.
Right. Important not to let our guards down. Urvashi, just a couple of days back when we were discussing on the show, again, there were rise in numbers and vaccination. To put things in perspective, of course, vaccination is important, but in terms of rising numbers, where do you see the vaccination drive gaining importance?
Yes, so I think, as we've discussed previously also, that, it has to be a two-pronged strategy and approach, really. I mean, the vaccination is obviously a very, very important pillar of this whole strategy, because the faster we can vaccinate the larger number of people, we will obviously help to bring down the spread and also the impact, very importantly, of the virus, because we will at least protect more and more people from developing a severe form of the disease or, losing their lives, which is, of course, our biggest priority is to save as many lives as possible. So, of course, vaccination in that is a very, very important pillar. But, of course, alongside that also needs to go our other public and private health and hygiene behaviors of washing or wearing the mask, doing, keeping distancing to the extent we can. And a lot of that, sometimes slips. Especially, there's a fatigue, of course, there's a pandemic fatigue, but also as the vaccination starts to pick up, it can start to create a sense of complacency or, something that we often term as vaccine euphoria. So we need to guard against that as well. We have to remember that, of course, the vaccination is crucial, it's essential, but it's not the only strategy. We need to follow both these strategies together if we are to really consistently control the numbers. Otherwise, it's very natural in pandemics, for these sort of waves to come and numbers to go up and down. So, as soon as we go a little lax in our behaviors, it's not unusual that, numbers start rising in many cities. So we certainly need to guard against this. And the best way to do it is to both accelerate our vaccination, as well as make sure that we don't, show any kind of laxity on our personal health and hygiene.
Right, Urvashi. Right. Let's broad base this discussion. Dr. Aparna Mukherjee, let me start with you here, ma'am. We have seen vaccine production that, of course, like India is among the top countries which is being credited for its pharmaceuticals, its research, and of course, vaccine production. In days to come, and of course, like keeping our domestic demand in mind as well, what role India could play worldwide in terms of production of vaccine?
Right, as you said, India is already a powerhouse in terms of producing vaccine. Like for the childhood immunization, a large chunk, almost 60 to 70% of world's production is from the Indian companies. So they already have the know-how and their infrastructure to actually manufacture large-scale immunization doses. So I guess this could be utilized, and with the support of the government and now with the support of all the other agencies as well, this can expand and it can cater to the domestic as well as the other country needs.
Right. Certainly, so domestic and other countries. But ma'am, in terms of the vaccination drive, like say in couple of days to come, possibly we'll hit 3 crore mark. That is like 2 months after we start a vaccination drive. That is January 16th. Now, if we look at calculated vis-a-vis our population, 3 crores, may sound very small in terms of 130 crore. But sheer pace of vaccinating 3 crore people in 2 months, how do you see that? Is it something that we need to spruce up, or are you, as a medical professional, you're fairly satisfied with it?
Initially, we did have some hiccups. The uptake was a bit low, and there was some vaccine hesitancy. But then, from then, it has picked up, and we are vaccinating at a very good pace, and we are prioritizing it so that people who need it most, and as Rishi said, so that we can prevent more deaths and serious complications. So those population are being now catered to, and people are being encouraged, and I would really request them that anybody who has the chance to go and take the vaccine.
Right. Urvashi, your take, let's start first with the vaccine production in India. What role do you see India playing worldwide in terms of vaccine production market?
Yeah, so I think India is already playing a big role. Of course, as was mentioned by Dr. Mukherjee, that in a range of vaccines, India is sort of the vaccine hub for the world. And even in COVID times, through our vaccine Maitri initiative, we have supplied so far around 60 million doses of the vaccine to 70 odd countries, and actually 92 countries at least have approached us in total for the vaccine so far. So this number is probably going to go up much higher. So in addition to what we are obviously doing for our domestic population, and that of course has to be a priority, there's no two ways about that. We are also supporting and reaching out to other countries, because I think we have followed this sort of principle here that we can't believe in vaccine nationalism, which we are seeing in certain parts of the world, because this is a pandemic. And a pandemic is not going to end across the world until it ends in every single part of the world. So any country, anywhere in the world, if the pandemic is still raging, it's a threat to the rest of the world as well. So I think our, vaccine Maitri initiative is grounded in this belief and is grounded in this principle that, of course, we have to prioritize our domestic needs, our domestic population. But whenever and wherever we can reach out to others and we can use our already very robust manufacturing capacity, then we must do so, because that is really the most effective way to bring an end to the pandemic is different countries and different powers joining hands, which is what we've seen through this Quad partnership as well.
Like as we talking about the Quad partnership of the four countries, four major powerhouse in terms of the economy, in terms of the sheer size of the population, and of course like the technology of these four countries in the Indo-Pacific region. At the same time, this region is also marred with certain countries which are not on the equal footing, be it their economies, be it their size of technology. How important do you see India playing a role here in terms of striking vaccine parities in those countries, of course, with sprucing up the vaccine production?
Yes, exactly right. There are countries at very varying levels of development, from the economic perspective as well as their health system, and therefore, actually, India has tried to reach out to countries in its neighborhood throughout this pandemic. It was whether through providing PPEs or other supplies, medicine. So vaccine is sort of an extension of what we have been doing actually for the last several months, precisely with this spirit in mind that everybody is at a very different level of development, and so when we can help out somebody, whether it's through know-how, whether it's through financing, whether it's through how do you do last mile delivery at scale. Something which we are very, used to doing in India. We plan for things at very large scale. We should do that. And I think the Quad partnership brings these complementarities. So, if you see the partnership in respect to the COVID vaccination, the US and Japan will be providing financial support largely. Australia will be providing support in terms of last mile delivery, and India will be mostly bringing in its very large manufacturing capacity. So there's a lot of complementarity in this whole partnership that is being proposed, and this can be a very useful way to reach out to those countries which might not have the wherewithal, might not have the might that such a partnership can actually bring to the table. So I think it's exactly a step in the right direction that we are taking through this partnership.
Right. Dr. Mukherjee, your take, the way we have seen this pandemic spreading in last 1 year, the way we have responded, and now with the Quad, these four countries coming together and striking an understanding, or to say partnership, in terms of fighting this COVID-19 pandemic jointly and doing every bit of effort so as to, boosting our vaccination production. How important do you think is it for these four countries coming together and, of course, working in that direction? Dr. Mukherjee.
Yeah, cooperation is very, very important at this stage because pandemic can never be fought alone. We are not islands that we can actually, social islands, isolate, we can fight it in isolation. So vaccine nationalism, as we call it, that only our country should get the vaccine, only the ones who can afford can get the vaccine. That is a very dangerous trait against which, everybody with sense will say. So this cooperation will help in utilizing the strengths of each of the partners so that it can be, as said, it can be complementary and it can help deliver the vaccine to other countries as well.
Dr. Mukherjee, do you see these four countries, since we're talking about the Quad and the initiative, these four countries sharing say intelligence in terms of the manpower, in terms of the medical fraternity, so as to make better use of collective manpower?
Yes, because vaccination does not only entail the discovery of the vaccine and manufacture of the vaccine. There is something that is actually distribution of the vaccine. The last mile delivery of vaccination is very important. So countries like India, we have that infrastructure and we have that know-how because we have been vaccinating large number of our children of past few decades. So that can actually help in setting up for the other, setting up such infrastructure for those other ones who need it.
Right. Urvashi, here, how important do you see cooperation in terms of, say, the basic know-how of using vaccine and taking to the last mile, as you yourself mentioned? Why I'm asking this question is, given COVID-19 vaccination at this stage happens to be the one which is administered by the health workers. And there are disparities in economies, disparities in the health structures among several countries. So how countries which are at least self-reliant to that stage would be able to help other countries?
Yes, so exactly, because in a vaccination process, there are so many steps which are involved, and there are so many elements. You of course, throughout the whole process, you need the financing piece, which is of course very important, and which is where some of these countries are coming in who have that sort of financial might, and they can afford to actually support other countries as well. So that is one piece of it. But then yes, apart from the actual research and development, the manufacture, the distribution, and especially at scale, I think that's where India has perhaps the maximum expertise, because we do any of such any such programs that we implement, we have to do it with great scale, with great diversity. We also have a lot of diversity to contend with here. So there is a rich experience base that we have, even in aspects like dispelling, myths and misconceptions.
Yes.
Vaccine hesitancy is not limited to the COVID vaccine. Of course, we see it more acutely, perhaps with a new vaccine and new disease, but we've been tackling hesitancy even with vaccines which have been around for decades. There's always some myths or some misconceptions that, often go around. So we have a rich, experience of tackling all these different aspects of it. And to the extent that we can actually share that, our digital experience now with the CoWIN application and how that is being rolled out at such massive scale. Again, that is something that a lot of countries would be interested in sort of learning from that experience. What are the challenges? What are the pitfalls? How do you overcome them? Etc. So I think there's so many different aspects of the actual implementation and distribution part where India can bring a lot of technical know-how in addition, of course, our large manufacturing base. So I think we bring both those to the table.
Dr. Mukherjee, in terms of the challenges of the vaccination drive, I mean, if we look at the global scale, where do you see? Why I'm asking, because you see, the Quad group has now formed, or possibly will be forming, a vaccine expert group comprising of top scientists, officials from governments, including like the government of Indian experts. Now, this group will support Quad cooperation on the long term and use of science and evidence to design an implementation plan for COVID-19 vaccine effort. How important are these initiatives so as to counter this pandemic, which at this stage seems to be here to stay for some time?
Well, it's very important. One of the reasons why these vaccines in COVID-19 pandemic, we have been able to manufacture them. We have been able to go from the bench to bedside in such short time is because there has been immense cooperation between the scientific organizations, laboratories, countries. So somebody might have one know-how, another person might have another different technology. So those have been shared, which is unprecedented that these kinds of collaborations have happened. So this is very important in fighting a disease that is like affecting everybody in the world.
Dr. Mukherjee, before we close the show, just one last question to you, ma'am. Given our size of population, given our density of population in certain states, and of course, like we have seen in the last few weeks, there are few states where the numbers are reported on a fairly alarming scale. How do we ensure that at least our domestic supply are not affected, given our stature and given our contribution towards global production?
Yes, it is not that we are taking away from our domestic supply and giving it to somebody else. We think we are self-reliant. We think we have enough manufacturing powers to cater to all our needs, and along with that, also help others. So it should not appear that we are depriving our own people and then giving it to others. It's not like that. We do have a very robust manufacturing system. That's why we are being actually approached, and that's why we are lending the helping hand.
Urvashi, your take on balancing our domestic requirement vis-a-vis being contributing or standing up to be there and counted at the global scale, contributing in the vaccine production?
Yeah, so I think it's very clear that obviously we have to prioritize needs of our domestic population, and I think that is something that people should be rest assured that, this is not a conflict that, we are doing this we are helping other countries at the expense of our own country. That's not what is happening. And that is not, the principle behind it as well. As I said, the principle is very clear that, we realize that in a pandemic, we are all in it together. And so we cannot think of it as, just us versus others. And so that is driving our, extension of help or support to a lot of the other countries. And some of these are actually very poor countries, which otherwise might not have access to these vaccines at all. So I think that's very important to remember when we talk of vaccine equity as well, that we not only want to obviously reach out to people who cannot afford or who are underprivileged in our own country, but we're also trying to help people from similar backgrounds in many other countries, which would not have the wherewithal otherwise to provide access to vaccines. So I think the equity question also needs to be looked at not just at the national level, but also what we are doing internationally. And I think the two are not at conflict with each other. We will obviously prioritize and ensure that our national population is covered, and we do whatever we need to here to get the vaccine to as many people as need it and should get it. But alongside, we will also continue this initiative, because that is really, that parallel approach is really the best way to try and eventually bring an end to this pandemic.
Right. Urvashi, many thanks for joining us, and Dr. Aparna Prasad, many thanks for joining us. And of course, this is extremely important issue. These experts, they quite agree that, of course, given our scale of manufacturing, there is a balance that we have achieved here. We are self-reliant in terms of providing vaccine to our domestic requirement. There is no shortage. There will be no conflict in terms of that. And also standing up and be counted as amongst the global producers of the vaccination. Well, that's it in this edition. But before we leave, here is a small appeal to all our viewers. And this is something even our experts keep saying in our show. Keep wearing masks. Keep following COVID-appropriate behavior. Keep washing your hands. And do not forget to maintain the physical distancing. Remember, these are small things that can help us in defeat this pandemic. Remember, do not get complacent. The pandemic is not over yet. That's it in this edition of India Fights Back. Thanks for watching Sunset TV. Goodbye.